I'm going to start a lifestyle magazine where I talk a little bit about lifestyle, a little bit about what doctors are doing in their personal lives. Because, I think people don't think we're real, or that we have kids, or that we have feelings, or that you think about your patients when you go home. And so I wanted it to be a little touchy feely, a lot advocacy, because I found myself as I was probably right around 50 when I became what I call an accidental activist.
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarrett Patton.
Welcome to episode 90 of Licensed to Live. My name is Dr. Jarrett Patton, and I'm your host for our journey together today and every day you choose to listen to this show. If you or anyone you know has been dissed in their career, please invite them to join us along this journey. Just go to your favorite podcast player and subscribe to Licensed to Live. And if you're there, feel free to give us more feedback, because we love the feedback. That helps us design the show better, get better guests, get the best information that you want, and that's what we're doing today. So if you've been dissed, then you guys know what I mean by dissed, displaced, disgruntled, disenfranchised. This is the right place for you. Today we have Dr. Marlene Wust-Smith. She's a pediatrician. She's the CEO, founder, and editor of Physician Outlook magazine. And she has a lot of things to tell us about not only her journey and her story throughout her career, but what we're doing in the overall landscape of physicians. So we will get back to our conversation with Dr. Wust-Smith right after we finish thanking our sponsors.
Something smells good. EH3 coffee. EH3 coffee. Premium organic. Nothing better than waking up. EH3 in your cup. Premium organic. EH3 coffee. Nothing better than in the middle of your day. EH3 coffee. Premium organic. EH3 coffee.
Hey, this is Dr. Jarrett Patton. Do you need more positivity in your life? No matter what part of your life you want to transform, positive affirmations can help you achieve your goals. But sometimes making permanent changes can be difficult. Designed with you in mind, Licensed to Live, daily affirmations to rebuild your life will inspire and equip you to become the best version of yourself. Licensed to Live, daily affirmations to rebuild your life will set you on the path to changing your mindset, beliefs, speech, and ultimately your actions. You can change your life now by getting your copy at Amazon, Barnes & Noble, your finer book retails, or licensedtolive.com. That's licensedtolive.com.
This is Super Bowl champion Mike Logan, and you are listening to Licensed to Live.
Welcome to Licensed to Live, Dr. Marlene.
Thank you. Thank you, Dr. Jarrett. Good to see you, this time over Zoom, not in the flesh, like when we met at your conference, which was excellent.
Well, thank you very much. And I missed that. And just thinking about the conference back in July, we got to engage. We saw lots of great speakers. It was really a great time. And to think about kind of where we were temporally back in July, where the COVID kind of was in a lull and it was nice to be in person and face to face. And now here we are getting our interview done over Zoom just to keep it safe. So thank you for giving us the time today and being with us. So I want to start off because I love bringing pediatricians to the show. I do not always get to interview pediatricians. It's just something that is near and dear to me. And it's when I bring in my fellow brothers and sisters on the show, it's like, yes, let's talk about something. So, well, we won't bore you guys with our talk about vaccines and kids growing up and all this kind of stuff. But I would love to know kind of your career as a pediatrician, because you have done so many different interesting things over time. And at the end of the day, you found things that work for you. So how exactly did you do that?
So I think I've always wanted to be with children. I think I'm a big kid, always loved children. I think when I was very young, my dad asked me what I wanted to be when I grew up. And I said, maybe a school teacher. And he's like, oh, no, not with your spending habits. I like to shop even as a young person. And I thought money grew on trees at that point. He was a recent Cuban immigrant, but always, gave what he didn't have to make sure that I had everything I wanted. And I didn't really understand. And so I think I came up my next answer was that I'd be a banker. And he's like, well, you'd be making a lot of money, but not for the reasons you think. You can't go in the back. And then I said, well, what could I do that I could be with children and make a lot of money? And he lied, because pediatricians do not make a lot of money, as we all know. But he's like, you could, in his thick Cuban accent, you could be a doctor for kids. That's a good, because his sisters, I call him the first feminist, because he, Cuban, Ricky Ricardo, kind of always flirtatious. Somebody on the outside would say he's not respectful of women, but he's just an old flirt, doesn't mean it. And for myself, and especially my sister, I have one sister and two brothers, he really respects education, especially for women. So I have to thank him for giving me that. I think I probably said that when I was 6 or 7. I kept repeating, okay, I'll be a pediatrician. And I grew up very young, not seeing pediatricians at first. We would go to emergency rooms because we were new immigrants. I was born in the U.S., but they went to emergency rooms in Upper Manhattan. But I learned what a pediatrician was. Got into Cornell undergrad, and quickly said, no way am I going to be pre-med, because these people are crazy and they're cutthroat and I'm not as smart as them. I have a very high emotional intelligence, but I'm not a Mensa type smart person, but I have good instincts and I study hard, and I've always been able to reap the benefits, but within a year or two of being pre-med, I was like, oh, hell to the no, these people are crazy. The intense pre-meds. And I switched majors. I think I'm probably one of the few Cornellians that got into arts and sciences as a bio major and went to human ecology to be a human development and family studies major, because I found it super interesting. And I thought, well, I'll be a psychologist, I'll be something. But it actually worked. I applied to medical school, and I think my application was so different than everybody else's. I got in early admission before all those other fools who were cutthroat. And
the cutthroats and the gunners and everybody trying to shoot everybody down. Yeah.
So, and then the rest is history. I never thought really of anything other than pediatrics. Just loved it for a time. Actually, right after my pediatric residency, I did start an anesthesia residency because I was dating a surgeon at the time. And just for lifestyle purposes, I thought, well, I'll be a pediatric anesthesiologist. And I feel like the big guy in the sky always knows what's right for us. I broke my a ligament in my thumb, which made it very hard to be an anesthesiologist, and I broke up with the cheating surgeon. So all was good, and I landed the best job a pediatrician could ever have, right across from New York Hospital. A practice that was, he had never taken on basically an employee, but I got to see the best mix of the very, very wealthy of the Upper East Side, but also nurses and doctors' kids, and then I started seeing the nannies' children of the very wealthy, because I've always enjoyed that, seeing the across the spectrum, because I think in my next life I would be a family practitioner with a focus on peds, because I've always liked to really understand what makes a child who they are and how can they improve and how can you improve them as a family. So it's my calling. I love it, and I love to talk, and I love to diagnose. I feel like I have a gift for especially children and families with developmental disorders, trying to kind of find their gift and their value when everybody seems sad or depressed about what's wrong with the child. I love to find what's right and what's made that family tick.
Credentials verified.
And that is one of the things that is so refreshing about taking care of kids and families. And there's just so much in the inner dynamics. And yeah, sure, there's some genetics and sure, there's some science. There's a heck of a lot of growth and development, but you're always thinking, and you're thinking about the bigger picture. You're thinking about the bigger picture, not only, well, what is this disease process, but how does that fit within the bigger structure of one's life? How does that fit in as the child in the family unit, within that neighborhood, within that zip code, so on and so forth. And that's kind of how we continue to operate. And I know you had continued to operate on that, not only in your medical career, but in your career as chief editor, CEO, and founder of Physician Outlook magazine. We'll get to that in just a minute. However, I want you fire starters to understand out here, it's about the bigger picture in life. It's about the bigger picture in what you're doing. So don't always have that narrow focus that may limit you or even limit the outcome. Just as Dr. Marlene says, that big guy up in the sky is looking out for us every single day. And sometimes things may not be going in the direction we think it should go, but in the end, it's going to be all right. And you just have to proceed and persevere and get to that point. Now, with all that being said, Dr. Marlene, have you ever been dissed before?
Oh, no, not another test.
Oh, yes. As a matter of fact, I don't know if anybody's noticed this, but the reason I founded Physician Outlook, if you look at the initials, it's PO. And I just love that play on words, because the reason I founded it is that physicians need a voice because we are being shut up, marginalized, and we need to speak out and speak up. And so I think the peak of when I realized I was being dissed is when I was employed as a pediatrician at my local little hospital. I purposefully left New York City and the Hamptons to move to a very rural part of Pennsylvania because A, it's beautiful. B, we had a 6-year-old at the time. She was 5 when I interviewed. I didn't want to raise her around like this. I wanted her to have like a normal upbringing, not the doctor's life where, Mom, I want Uggs. And she came home from kindergarten one day, and I was like,
"We'll go vacation in France."
Yes, yep. So I wanted her to have like a more normal upbringing, and frankly, the salaries are great in rural America. If you like it there, my husband loves it there. I'm a city girl, so it took a little adjusting. The first month we moved there, my husband has a bat and he's running outside. He's like, "There's a bear in the yard." And we lived on Main Street in this little town. I was like, "Oh, come on, you're watching way too much." And no, there was like an 800-pound bear. I was like, "And what do you think you're going to do with a bat?" But that was before he started his collection of firearms for hunting up in Potter County. But I didn't really believe him until I actually physically saw the bear at a feeder. But so we moved up to this rural area. I loved it, loved seeing the patients. And I quickly got moved up through the hierarchy at the hospital in terms of being asked to take on administrative roles as well. And I actually enjoyed it because it was a small town place, independent hospital, but I think they were starting to make the move towards becoming part of a bigger corporate. And it's that cookie cutter kind of hospital administrator mentality where stuff doesn't make sense just because, some hospital association tells everybody to, make sure all your nurses are dressed in gray on this floor because patient satisfaction goes up. We got a lot more fish to fry than, what the nurses look like. Like, how about making sure that, that we have, enough staff to cover, the emergency room or whatever it was. It just seemed like silly that we were doing all this other stuff. And I don't hold my thoughts to myself. So I would challenge and ask, shouldn't we do this first or that first? But when the electronic health record arrived, and I was one of the champions, I was like, no, we're going to get this in outpatient first. We don't need it in the inpatient unit. We need to champion this. We need to move off paper. And I realized how detrimental it was to our patient care, and that I was spending, up until midnight. My office hours would end at 4:35, and I'd go to my daughter's games, whether it was softball, volleyball, basketball, with the stupid computer in my lap, working off Wi-Fi, trying to finish the notes from the day. And it was my CEO and my direct supervisor thought that I must not be able to type. So I said, send somebody to watch me, and I want you to understand what it is, the pain point, because everybody else just kind of rolled over and took it. I had a little administrator dude follow me every day with like a full day with his little notepad, and we didn't eat lunch. We barely went to the bathroom. And then he tried to leave at 5:00. And I was like, and he's like, well, this was very interesting. You actually are very good with the keyboard. I was like, yes, I am. It's the 900 clicks it takes to do one thing that is a problem. And then he tried to leave. And I said, oh, no, this is when the fun begins. All my tasks, let's come back here. I haven't finished or signed off on any note. And so the diss that happened was that he took that, made a report, and then they paid somebody, a consultant, $30,000, some ridiculous amount of money to come write a report, do the same exact thing, to basically write up everything that I've been saying for the last few months. That we have doctors doing clerical tasks, so that you have nurses not allowed to critically think that the standing order sets had gone away. And a related one, I with a badge of honor, I loved that the CPOE, the computerized physician order entry, the poor nurses had like on a bulletin board hidden in OB, like what rate it was. And they were like, Dr. Smith, you're like at the highest and we're supposed to bring you down. But what are the order entries for pediatricians in OB? Routine baby orders, right? Yes, they wanted us to crack open the computer every time a baby was born at whatever hour it was, because the nurses were not allowed to put in order sets. And I just fought that tooth and nail, because that is, then when they do call me for a real problem, I'm not going to pay attention, because it's not an emergency to be paged to put in a routine baby.
Routine orders. So many stories, Dr. Marlene, especially the diss stories, begin with well, when I was employed by such and such. Mm-hmm. And what you need to learn from this is that we all go through our transitions. We all go through these phases. And this is why I asked every single guest that comes on the show about these things, so that you can see that they are something that happens to us all too often. And in your case, you're trying to stand up for the rights and say, this is what a doctor's day looks like with computer records. So come on in. Yeah, great. The patients are done, but the work is just beginning. And they don't necessarily like that, even though they can see it. And then they have to get somebody else to verify it. And then they pay them lots of money. And then maybe things never change. But if you're smart, you don't stick around to find out. You just say, you know what, this isn't going to be for me. I need to go find something else to do. And
that's what I did.
yeah, that's exactly what you did.
My dad still thinks I'm crazy. He's like, I accidentally heard a voicemail. He thought he had hung up, and he was telling a friend, he goes, my daughter went from like this crazy high paying job. She got like 14 jobs now. But I think I've never been happier. I take on a lot. The pandemic has put on a whole new stress, but I feel in control of my own destiny instead of being angry at people or different. I started doing locum work when I realized that the big diss was that nobody would stay at our hospital. It was myself and another doctor, and they'd pay these doctors to come in, and they got paid for every hour of documentation, and they saw like a quarter of the patients, and they couldn't do all the psychosocial stuff. And I was like, that sounds like an interesting job. So I started doing some locum work, and it gave me a new perspective. I shouldn't have been angry at our CEO. It's the industry has changed, and the places that have maintained a sense of integrity, and where the nurses, doctors, respiratory therapists, where everybody seems to work cohesively are the places that have rules. They're not just practicing cowboy medicine, but they allow bending of the rules where common sense prevails. So they may not ask the patient if there's one nurse and 3 rooms. That nurse, you notice them not asking every single time, what's your name and date of birth? What's your name and date of birth? What's your name? That loses, the patient doesn't understand. They just think that you're like an impersonal fool. They don't realize that, the reason they're asking is because you don't want to give the wrong medication, but it becomes ridiculous if it ruins your patient relationship. And that's what we're losing in medicine. And I'm going to continue to cry it out from the hilltops that yes, we can modernize medicine. We can make things better and more efficient, but we can't lose the human in medicine. And we don't want automatons to just be our next wave of healthcare providers, whether they be physicians or nurses. It's happening to all of us at every level. If you look at it, our best registered nurses are leaving in droves because they're not respected. They're expected to just follow the rules, supervise 20 LPNs or MAs, and hope for the best for their patients. That's not why they went into nursing. That's not why you and I went into medicine. You want to connect with your people and have a team, a true team around it, not lip service.
You're working together, building those relationships and taking care of people at the same time. And that's what we all wanted. That's what we all look for. And people that are walking away from the situation that really is not ideal for them is not that. You do have choices out there. And sometimes it's a hard decision to make, but you have to have a little bit of courage and know that there are some places that are doing it differently. They're trying to transform the way things are done, trying to bring those relationship issues back forefront and center. And it's not just lip service. So you got to do yourself a favor. Now, this brings me to another platform that you have, that you're able to spread this message and spread this voice and say, hey, there are some things that need to change. There are some people here who have stories to tell. And you founded Physician Outlook magazine. So yes, I would love to know what drove you to go to that point from, physician, pediatrician, taking care of families and patients, to saying, you know what, I'm going right into the magazine industry and starting my own.
So into publishing, I was doing dabbling and doing a little bit of writing for a magazine called the Hispanic Outlook on Education. And I noticed that when I would write something about medicine and shared it on social media, it got some traction. And a lot of it was because I would say what I was thinking, and I didn't care who I ticked off. I just would say, this is what's happening in medicine. And especially if I spoke to a patient, if, I'm a doctor, but have you noticed, do you think we love this computer? Like, why aren't we making eye contact with you anymore? It's because of this. And did you know that it takes X number of clicks to do this or that? And so I started writing for them and wrote and saw the power in it. And I think I was on one of my flights to a rural assignment, to a locum assignment, when I said, the magazine in the back of the airline seat before COVID, because people are not going to know what that is. But they're enjoyable articles, but the ads are as interesting. Sometimes you always end up getting something you don't really think you need or want, but it compels you to I need this gadget, or it's like watching Shark Tank. I always end up with it's just cool things for travelers. And I thought, I'm going to start a lifestyle magazine where I talk a little bit about lifestyle, a little bit about what doctors are doing in their personal lives. Because, I think people don't think we're real, or that we have kids, or that we have feelings, or that you think about your patients when you go home. And so I wanted it to be a little touchy-feely, a lot advocacy, because I found myself as I was probably right around 50 when I became what I call an accidental activist. Met our mutual friend, Marion Mass, and she was like a little firecracker. And everything she wrote that I read, I was like, it's like she took the words right out of my head. Nobody had ever actually had the guts, the ovaries to put it in.
That's right.
So, but yet I was always one of these I have too much on my plate. Why would I want to talk to a legislator? Or why would I want to change the system? And I've learned through these kind of grassroots groups that you really can change things if you realize what it is that you're asking for, and then educate legislators that are they're originally for the right reason, and then they get corrupted. And so I thought, just let's educate people like me they know about politics. They show up to vote, and medicine shouldn't be about politics, but it has way before COVID. It has a lot to do with policy. And if you look at what happened in medicine, throughout the years, whether it's World War I, World War II, then, how we have gotten to where we are, and why we spend so much money in the United States, and yet the care is it's excellent, but it's lacking transparency. I think that's where I am today. I want to just shine light and not necessarily take down systems that exist, but let's see how we can all coexist together and make sure that the marginalized, though, have the option to access the very best healthcare. And my observation is that we've all now become, instead of all getting excellent care, we've all kind of gotten this terrible kind of mediocre care, somewhere in between those two worlds, because the rich are always going to be able to access care if they want to.
Sure.
And the poor used to not be able to get into a specialist. And that has changed. Every hospital takes Medicaid. Every person who is very, very low income, or in some states who are immigrants, can get healthcare. But what about our working poor and our middle class? And so how do we make it fair and
it becomes
even
unaffordable?
Yeah. So that's what I think that's my driving passion. And I don't understand how everything works. But I like to take individual examples and write a story about it, and kind of stimulate thought, and how can we change it if it needs to.
And I think that's a wonderful way to wrap up your magazine, because, well, we want to get some of those stories, and some of these stories are emotional, and they kind of get at your heart. Some of the stories kind of take away that veil across healthcare, and maybe take a different side of something that, well, it was probably a pretty ugly underbelly, but let's look at it a little bit. And so you're getting a variety of different stories that are written by different people. You have guest contributors as well. And it's all for the physician. It's all out there for us. And I think that one of the cool things is that you still have your magazine in print, right?
Well, and I think because of my age, I'm going to be 60 in 2 years, a year and a half. I feel like my generation grew up, we had the first Macs, the big orange, I think I had every device ever known to mankind. And so we've adapted, we know how to use it, but I think we still have a love of paper and a love of how to learn from a journal, how to read a textbook, how to abstract information for ourselves, how to go to the source. So I know that I can't find probably 3/4 of my medical school class or my co-residents on social media. And if I do see them there, they're very distant, they're not engaged in what's going on. And so I want to reach them to see how they're doing and are they happy or are they retiring? When I do find them, I find that they're in their very early 60s and retiring already. And that's not the norm. We all grew up knowing the Norman Rockwell kind of, they doctors loved what they did, and much to their families, dismay, they wanted to be in the office. They wanted to be in the OR. They wanted to be with their patients, and they love their families too, but it was a calling. And I feel like I want to know what's going on. How do we reach those people, and where is their happiness, and what's the secret sauce that makes for a happy older physician, or have we lost it? And another reason to call it out. So I'm trying to reach my colleagues that would never go on physicianoutlook.com to see what Marlene's up to. The magazine covers are physically beautiful. Almost all the art is created by physicians or a physician relative or a scientist. And it's not your traditional magazine. I do what I want, and it's awesome. And I have no training in it, but I think we're producing a really good product that will eventually change medicine. I'm confident.
And that's exactly why you're in this venture. You want to change medicine, and through your voice, through the voices of many others, it gets amplified. And you're right. I mean, when I read my, digital newspaper subscriptions, you're kind of scanning. I'm tired of looking at a screen anyway. I can't wait for the weekend edition so I can open it up and feel it and touch it and really let my eyes focus on it without straining. So there's something to all of that. And knowing the audience that you're reaching out to, knowing that there are so many of us that are still out there, and sometimes we get disconnected from each other, maybe as a class, as you mentioned, but each other kind of out there in space. The pandemic has caused so much isolation, so much distancing of each other that we rarely have occasions in which we are coming together. So one of your overall principles is just really getting these messages out, some stories and some good information. And I want everybody to check out, and it's going to be in the show notes. Make sure you go to physicianoutlook.com to make sure you check it out and see what Dr. Marlene is doing.
And use the, I think it's podcast is the code to get $30 off. You can get the digital, the online subscription, and I'll give you a code. Anyone who wants to read all the articles, I'm happy to share it, but we need more subscribers so that I can afford to continue to print these and send them in bulk to the hospitals. And luckily, the CEOs don't really read them, so they've left them. I want that one. We've done an analysis. One copy does go from one physician to another. So when we deliver it to one office, it exchanges hands, and about 10 to 14 people will actually read it cover to cover, and they're interested in what they see. And our ads are primarily physician businesses. So I want to advertise interesting conferences, not the boring, they have huge funds to advertise, at the big hospitals for their conferences or the AAP or whatever. I'm interested in License to Live conference, in the different coaching businesses, success stories. Dr. Jeep is writing relationship advice, like stuff you're not going to read anywhere else. And even just podcasts, the multitude of podcasts that's out there. There's no not enough time now to actually discover it all. I want our magazine to be the Reader's Digest of what's out there in the physician world, and so that everybody can find their groove and find their happiness and continue to practice medicine, hopefully in some way, shape, or form. Because I think who's going to be left to take care of us if we're all leaving, so that's behind one of my passions, is to see how we can take power back away from the let them do their thing, but let doctors punch in and punch out like other employees, but as independent contractors. And then on my time, if I want to see my patient, I don't care. You can't tell me that I can or cannot. You can hire all your minions to make sure I'm not stealing your patients. But if you're not offering a service and my patient wants to see me or hear from me, don't stand in my way. And the patient should be able to negotiate. If they want to pay me in eggs because they're farmers or they raise hens, don't tell me that bartering is not okay. They can pay me in whatever way, shape, or form, but we should be allowed to be paid for our work. Not this, our intellectual property is no longer our own. And that's, right. I think, at the core, even researchers sign away their rights to anything they create. And that cannot be, because it's not
absolutely, right. It can't be. People, you're being used for your gifts and your intellectual prowess. And in fact, that is mainly what you're doing with surgeons. You guys may have a little bit more manual, actual procedures and things that you're doing. Many specialists do the same. But at the end of the day, it's the intellect that is really turning the system. And, hospital systems, the healthcare system in general, feels that intellect is the system's property and not necessarily your own, which makes it difficult at times for people to go out and maybe start their own business or maybe even start their own magazine. Mm-hmm. I love the fact that you, Dr. Marlene, simply took yourself and said, hey, I don't know everything there is to know about putting a magazine together. I don't know everything there is about publishing, but I have written a lot in my lifetime. I do know what kind of attracts people to something, and I'm going to go for it, and I'm going to do it my way. And these are the stories that we can highlight, and it may not be glamorous and it may not be glitzy, but when you're taking one step in front of the other and continuing to walk down that path, next thing you know, you're having your magazine delivered to hospitals all across the country. Physicians are getting to read this and being influenced and being enlightened to so many things that are going on. And you said, oh, this just all started from little old me. And you do something tremendous. So thank you for bringing Physician Outlook. Make sure you go to physicianoutlook.com. And if you're going to subscribe today, go ahead and subscribe with the code podcast. We're going to make sure you get the discount out there. And I have all of it in my show notes. Dr. Marlene,
send us your art and your writing. And I think I was when you said I've been writing all my life, actually, I wrote as a very young child, and probably like we all did in our, I always thought I would write a novel, and I probably somewhere have all the notes of what I wanted to write, but I stopped for 40 years, pretty much just working. And then I took it back up. So never be afraid to try something new. It keeps us young. It keeps our brains fresh, and it's refreshing. And you'll have your critics out there. You're going to have people who say, like, why are you breaking the mold? Why are you, it's an opportunity to just, feel young and try new things and show our kids that you don't have to be at the same old boring job and be told what to do. You can stand up for yourself and you can do your own thing, and you can carve out. I think it's important to carve out the time you need for yourself and for your family, not to take on too much. I'm still learning that, because I take it all on. And I have to, just kind of make sure that I make time for my family, and because it's family first, God, and for our careers, but also for each other. I think my goal is to lift others up and to make sure that there's not physicians down in the dump and their families, because we're so disenfranchised as to what's happened. You spend 30 years in a career and then somebody's telling you how to do it. And it would be great if they were saving money and great outcomes. We all know that that's not happening. And so we need to speak up.
Never be afraid to try something new. The words from Dr. Marlene Wust-Smith. Thank you so much for coming on License to Live today. Would you have any final words that you would like to say to our audience today?
I would like to say that I would love to meet each and every one of you in person. So this pandemic is putting a damper on our lives, but I think we need to learn how to do things safely, but not to allow ourselves to, when safe, leave our houses, gather again. I think if we learn nothing else from this experience, is that we need each other and we need that human contact, and let's all get healthier as a nation. Let's address the root cause of what has caused so much death and destruction, and let's start preventing health conditions and really treating them well, but so that we're at our tip-top shape and we can gather.
Final judgment. Licensed to Live.
Dr. Marlene, thank you for coming on the show today. We look forward to seeing what you have coming out next in Physician Outlook magazine. And folks, check out the links, check out the subscription, use the special code. And Dr. Wust-Smith, thank you.
Thank you, Dr. Jarrett. See you soon.
Remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disgruntled, disenfranchised with healthcare, please invite them to join us along this journey. Go to your favorite podcast player and subscribe to License to Live. And in between episodes, I like to hang out in LinkedIn, so make sure you come and connect with me there. You can find me across all social media at Dr. Jarrett and join in these conversations. You're going to see Dr. Marlene. You're going to see lots of other people out there voicing their opinion and seeing what's going on out there. So it's never too late to become an advocate. Make sure you're out there making a difference, not only for your own life, but for someone else. See you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarrett's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.